Thanks very much, mate.
No problem. It's nice to have you in.
Time to come and chat. What a beautiful place. Talk me through, we're in the heart of Hindland in the West End. Talk me
Yep.
through the practice.
So Highland Road, we've been open for 12 years, obviously. It was always Phil Advanced Dentistry, so Phil started the practice. I came back from Dubai in 2018, came in as an associate and now in as a partner. We're actually in the process of expanding to double the size as well of the site. So
Wow.
hopefully by the end of this year, we'll be up to 10 surgeries. So it'll be one of the biggest private clinics in the country.
Wow. So, I mean, I suppose the obvious question then is how do you get into dentistry? I know that sounds like a stupid question because the answer is predictably, well, I went to uni and did that type of thing. But it's not that straightforward,
not
is it?
everyone goes straight from school into uni.
Yeah.
That is actually what I done, but there's no fairy tale story of, I woke up when I was 12, went to the dentist and all of a sudden fell in love with dentistry. Like most boys in Glasgow, I wanted to play football. But you kind of realise that's maybe not going to happen. And thankfully I was strong in school. So got my exam results and dentistry was an option. And it did seem to fit some of my strengths. Good with my hands, played music, so I knew that was a strength. I looked after my dad as well since a young age, so caring for people, being kind of patient facing made sense as well. But it's a gamble. You're in school, you don't really know what to do. I ended up on the path of dentistry and I couldn't have imagined it would work out as well as it has, but it's been a great fit for me.
It's funny you say that there about being good with your hands because with cosmetic dentistry especially, there's a degree of like artistry about it.
There is. I mean, all dentistry is hands-on. You need to be good with your hands. Different procedures are going to have different skill sets. When I was applying, that wasn't really something that was in my mind. It's when they're asking you, what manual dexterity skills do you have? And you're like, well, thankfully, I do have this. Some people are good at art. Some people it's music. So it could be a trade. Could be anything really. But yeah, it's obviously a hands-on thing that you're doing day in, day out. So, in particular with cosmetic dentistry and the expectations that people have, it needs to be perfect.
What is the degree and the sort of complexity of the studies that you have to go through? Because that's probably something that plays in people's minds. They're trusting you with their mouth, with their teeth.
Yes. Dentistry, it's a difficult program. There's a lot of medicine in it, a lot of science in it. I mean, you're doing, I think for the first 3 years, pretty much what the medics are doing in the same university. But then you'll branch off and you'll do more head and neck anatomy, obviously dental material science, patient management. There's a host of things that you have to study when you're there. A lot of it probably doesn't feel relevant when you're going through uni. You're like, Jesus, the amount of things we need to go through and the hoops you jump through. But obviously, like any career, it's when you come out of dental school that the learning starts. And as a cosmetic dentist, you've not really been set up. That's not mentioned in university. There's obviously cosmetic aspect of any treatment is thought about, but there's no upskilling in university. So it's when you come out, you start doing postgraduate stuff, different courses, that you really get into the nitty gritty and what you need to learn.
So what was your career timeline? You graduate from uni, is it then, do you have to go and find yourself a placement? Are there job offers like on
Yeah,
the table?
so I mean, the conventional thing to do is you go into a training year or training 2 years, depending on whether you want to go into a kind of hospital pathway or a general practice pathway. I didn't fancy the hospital pathway. Having been 5 years in the dental school, it didn't really suit me. So I seen myself in practice. So I done my year as a VT trainee. That's on the NHS. Most people will stay in the NHS. Some people stay their whole life in the NHS, and that's great. Other people might branch out into private dentistry or a mixture of both. So I started off in the NHS pathway in my training practice for a couple of years. I then got asked to go to a completely private clinic, the Berkeley Clinic, which was a massive opportunity at the time. From there, I went on to Dubai for a couple of years and then landed here last of all.
What was happening in Dubai? Just again working for a private
Yeah,
practice?
I just had that itch to get out of Scotland and do something different. Seen people in Australia, seen people travelling, and I thought, I don't know if Glasgow's the thing for me for the rest of my life, so I need to go and try it. I went to Dubai, great place, but I ended up coming back. So
It has a time
Glasgow
limit
is
on it,
home.
doesn't
Yeah,
it?
it does have a time limit, and I think it's a different place now to what it was then. It's a place that's always evolving, but there was something about Dubai that didn't quite fit with me. I don't know if it was just I miss Glasgow. I don't know if it was family and friends aren't there. Dentistry's a lot slower as well. The demand for dentistry here, because of the pressure from the population and the amount of dentists, it's a very fast job. You're always busy. Dubai was a bit slower. You're maybe spending more time with people, which sounds like a good thing, but sometimes it was a bit too slow, particularly in the summer months. Ultimately, I made the decision to come back, and I don't regret it, but you never know in the future where I might go.
A large part, obviously, of what you do is all the experience that you garner and the courses that you go through and that sort of professional development, but personal brand is obviously such a big thing. At what point did you start, because you're really good at that, but when did you start to realise I can use social media to my benefit and to my advantage, and how important it is that the old saying of people buy from people as well?
Yes. Well, certainly when I first graduated as a dentist, you know, Instagram was maybe a thing at that time, but no one was using it as a personal brand thing.
Yeah.
Businesses weren't even really using it. So when I had my kind of finishing my cosmetic dentistry cases at that time, granted they were a lot smaller then, I'd be posting it on my personal Instagram, and there came a point where I thought I should probably have a separate Instagram for this rather than it clogging up my feed that's on my personal. So I think I was one of the first people, certainly in Scotland. There was a few people down south I'd seen had done it. So I've had that advantage in terms of being one of the first to be on there, and you build that profile over time. But you don't really think of the power of it. No one really knew the power of social media at that time.
I wish I did.
I would
at
say
its early stage.
I would say that's potentially one of the things that got me my first break in terms of into private dentistry, because it's a platform that other dentists can see you, peers can see you. It certainly was something that got me into Dubai as well, and that's where it really exploded, because Dubai is a huge market, a lot more people, and you're getting more exposure. So, but most importantly, when I came back to Glasgow from Dubai, when I started here, generally dentists, when you take a job, you've got a list of patients to look after. So it might be an NHS list of 3,000 or 4,000 patients. It might be a private den plan, practice plan type list. When I started here with Phil, we were having that conversation of me coming back from Dubai. He said, I've got like a room free, but there's no patients. I can send you some of the stuff that I don't really want to do anymore. You know, like he's mainly doing implants and surgery. So, and I was like, well, you know what? I live around the corner. I've got nothing to lose. Let's see what I can do with Instagram in terms of getting busy. And that's when it really opened my eyes in terms of how quickly I got busy and building the brand. And really Instagram, social media has been the builder of my business since then.
What were the sort of early stages? How did you do it? Were you putting up just sort of before and afters? Or?
Yeah, before and afters, that's the easy thing. I mean, it's validation for your work, isn't it?
Yeah.
I've created this. This is something that I'm proud of, and you're putting it up, and then from that, you see people are gaining interest in it, and it starts off simple like that, and now has a lot more strings to it, social media, and particularly having a personal brand. And I've actually have a bit of a plateau with it where I'm so busy that I don't actually need it, even just from word of mouth. Whether I post on my social media or not, I'm always going to be busy. And it's a kind of catch-22 of, I do want to grow my personal brand further. I know there's so many things I could do, you know, whether it's going on podcasts, whether it's spending more time filming stuff, talking to the camera, whatever it might be. You see the trends that come as well, but I just don't have the time to do it anymore.
Yeah.
I don't need to. I would like to be able to step back a little bit from the clinical work and from other business and spend it on building my personal brand, but it's not something that's guaranteed. You could spend hours a week on social media and it might not go anywhere, you know. It's whether people like you or not and whether the content's authentic. So I've just not got to that stage where I've really invested time into it recently, but it's always there if I want to do it, and the platform's there. So
good predicament to be in. So did you find that people just started then getting into, because it's funny that, isn't it, like for what is essentially a medical procedure, for somebody to seek you out? I know, I get it, it's cosmetic dentistry, I've had it done myself.
Yeah.
But did people just start DMing you saying, can I come and see you?
That's it. Yeah, you're posting up things, you see the likes coming in, you see DMs coming in. It might be someone's been in that is slightly influential, has a bit of a platform themselves, and they share it. And that's what social media is. It's attention. It's everyone's attention. Everyone's on it. So from that, the inquiries start coming in. And then, to be honest, now it's more word of mouth. I would say, I'll ask a patient when they come for their first consultation, how have you ended up here? The majority of people is some form of word of mouth, either a family member, a friend, or they met someone who had their teeth done and they asked, you know, things like that, or existing patients within the clinic. But there's still a big proportion that come through social media as well.
I appreciate you're going to have absolute maximum discretion, but who were the first? You don't have to name them, but there would have been a name that popped up, let's just say in your DMs, where you thought, wow, bloody hell. I mean,
it's a difficult one because without confidentiality, at the end of the day, most of these people have been on my profile, so I guess the confidentiality is already there and they've agreed to that. When I first started at the Berkeley Clinic, there was patients there like Paolo Nutini, and these were all people that were at the clinic already, and they just happened to be coming into my care. Rangers players were coming in, things like that. Celtic players, Cal McGregor, whatnot. But I think Gaza's the one that sticks in.
Wow, you're Paul Gascoigne?
Yes, yeah.
Did he come seeking you out, or was he already?
He came through Rangers, actually.
Right, okay.
and just needed a clinic for when he was in Glasgow, but we built a relationship from that. So, and to this day, seeing Gaza pop up on your phone, it's a story that I love telling.
Yeah.
It was a special moment, so yeah.
For everybody, absolutely no issue with that. We have Celtic fans, we have Rangers fans. For people who love Rangers, that's...
To be fair, we have plenty of Celtic, Celtic players and that in as well. So there's absolutely no preference there. Phil is my business partner, is a big Celtic man. I'm a Rangers man. It's just the way it goes. It's nice to have that mix.
Absolutely.
Everyone the same. You know, whether it's a patient you've never met before that has no profile or someone high profile, they still get the same care, they still get the same attention. And I think when people come in, for a celebrity or a player comes in and you treat them like a normal person, they like that better. I try not to push them doing content, or there's a lot of people who come in and nobody would know, because at the end of the day, they're probably getting asked for photographs, videos all day, every day. So it's nice to come to the dentist or whatever they're having and not be pressed for it. On the same token, you also want to leverage that a little bit to show off that, you know, there's people coming in and you're going to get that attention from their profile or whatever. So it's a difficult one, never pushy with it, but if I think there's a good relationship there, I'll ask, you know, maybe towards the end of the treatment, do you mind if we do something? Or I'd
imagine they'd be thrilled with the outcome and they think, do what you want. Like, they're absolutely delighted.
I don't know if you've seen the Billy Gilmore one, but he'd agreed to do some stuff with me. Really nice guy, we got on really well. And when he came in, I had a football and I was like, we're going out the back to do some play about and get a kick about, and we filmed it, and it was brilliant. That was a nice one. Just something a bit different rather than unnatural sitting in a surgery kind of, you know, here he is. So
he's quite good, Tim, aren't he?
Oh, he's they've got a big game. Is it this weekend?
Tonight, I think, aye. So it's league decider. Well. Yeah, aye. No, absolutely I love both him and McTominay.
McTominay's had a blinder this season.
Just unbelievable. Yeah. It's like, I think it was Joe Jordan. I know, that's mental, innit? They let him go. Joe Jordan was talking about it, and he's like, if they win the league, they'll never ever have to spend a penny in Napoli again, in Naples.
Yeah. Something about Scottish boys over there, even Lewis Ferguson doing well.
Josh Doig. Yeah. Liam Henderson.
Who's the left back that went from Hearts? Hickey.
Aaron Hickey, aye.
Didn't he? So
I think there's talk potentially of Lennon Miller going there as well.
Hopefully not.
Yeah. You mentioned something that just kind of I made a wee connection. You mentioned people feeling pressure and getting asked for pictures and that type of thing, and that is like a pressure element of their job. The pressure element of dentistry, this is something that would have never occurred to me, but two people have told me this, and then I saw a news headline that it's, and sorry to take this in a wee bit of a dark turn, in terms of profession, has the highest rate of suicide.
That was something we were told. I don't know if it is statistically correct, but it's well documented that dentistry is a relentless, stressful job for various reasons, whether it's patient complaints, whether it's the expectation of patients to deliver what you want, whether it's just actually by numbers. There's so many people trying to get into the surgery looking for treatment. And it's a difficult thing, you know. I'll have someone sitting in the chair and you know there's one person waiting in the waiting room. You need to quickly turn around and go again. And it's stress, people come in with pain, whatever it might be. And in every area of dentistry, whether you're NHS, cosmetic, a specialist, there's going to be different pressures. And not everyone deals with that well. And I think that's why we see this, is that, you know, thankfully I feel pretty mentally strong, but there's days and times where you're not as strong and you have your doubts about what you're doing, or, you know, something's got you down particularly. So there's obviously a lot of good programs just now and people trying to make an effort, charities and foundations starting, etc. But it needs to be spoken about more, mental health, and dentistry is definitely a career where people struggle. Yeah,
in terms of like the conversation topic, I sometimes actually, I don't avoid it or sort of try to divert from it, but I think like at times it's the topic has been either done to death or it's done disingenuously, with people trying to tick a box, or they think, what's going to get me numbers or a wee bit of adulation, a pat on the back. But I think in the right circumstances, and when there's like a specific nature about it, in the way that we're talking about it, I think it's great to get into. It's I did wonder, and I thought, what is it? Like, what is it about the job? And that all makes sense, because not only is there a huge workload and a huge pressure on you every time you're working with somebody, but I hadn't thought of that as somebody saying, oh, I expected something different, or making complaints, or, I mean, is that something that kind of happens generally? Do people think they had an idea of something?
It's a litigious profession. I mean, if something goes wrong at the dentist, quite a lot of people will want to do something about it, you know, whether it's legally, whether it's going to the General Dental Council. So you feel like you're on the hook. And I mean, I I take my work home in that sense. I care if someone's not happy with something or if something didn't go well, I'm going to be thinking about it, but it's being able to let go at the right time and have your downtime as well and manage your stress. So yeah, it's difficult. And I don't think people outside of dentistry really understand that. Even my partner, you know, I'll come home after a 12-hour shift and I'm like, I can't even speak. I mean, I can speak, but I don't want to speak because I'm talking to people all day. And what I always say is I'm brain dead when I finish work because you're at your upper limit of your communication and everything else. So you can understand if someone's then going home to a situation where maybe their personal life isn't going well as well. Where's your escape? Where you know, if it's not work, if it's not your personal life, then there's nowhere to hide.
Makes complete sense. To kind of come back to the cosmetic side, we've seen such a huge upturn in the demand for people to have like perfect teeth, whether it's whitening them or whether it's composite bonding, veneers, implants. I mean, you're right at the coalface.
Yeah.
Where do you think that comes from when people come into you? Because it didn't used to be this much of a thing. It wasn't so prevalent.
Yeah, I mean, certainly when I came back from Dubai in 2018, composite bonding that's where it probably started coming on the scene. And I remember thinking, I really need to upskill in this and take advantage of that and offer it to my patients because it is a really good non-invasive option for people. I think previously you really had either going down the veneers crown route, which is A, expensive, B, can be invasive. And there was no real middle ground. So now that composite bonding has become something that is artistically done to improve how teeth look at a reasonable price, good longevity, but most importantly, without really damaging the teeth underneath. I think that's why it's exploded through word of mouth, but particularly through social media. I mean, I'm sure you follow some dental accounts. It's every day there's videos going up of composite bonding, people having it done, people talking about it. So it's definitely the hottest thing in dentistry just now.
A lot of people going abroad, namely to Turkey, to get things done. What have been your experiences?
I usually say overseas, not to single Turkey out, because obviously there's other countries as well, and there's also really good dentists in Turkey. I have to say that some of the best dentists in the world will probably practice from Turkey. The thing about overseas dentistry is done very fast. So typically someone comes to get their teeth done. Occasionally it can be a fast thing. You're in consultation, 1 or 2 appointments and you're done. But the majority of the time there's work to do. There's the foundations to set with the oral health first. And then you need to spend the time getting the case right and doing it over a number of weeks or months. It can be done as a shortcut, but there's a price to pay for the shortcut. And that's what's happening in Turkey is people are they're getting it done in a week or 2 weeks, generally a week, I think. But it's very aggressive dentistry. The teeth are often prepped down to nothing or extracted. And some people get away with it, but they're not going to get away with it for long because once that amount of tooth tissue is removed, typically for the heavy prep crowns or veneers, problems are going to arise.
It's the sort of the world we live in. Everybody wants everything like done immediately, but something you need to spend a bit of time on.
And price obviously talks, and it is cheaper. And here we can't compete with the prices. You know, some of their prices are probably what I paid a lab to do it.
Yeah.
So how they can afford to do it, I'm not sure. But price talks, and for some people it might work, others it doesn't, and you just need to be very careful. And also consider if it goes wrong, what are you going to do? Are you going to go back to Turkey? Or are you going to then spend the money here and probably pay a lot to get them fixed?
Do you anticipate like a sort of upturn in issues? Because let's just say that phenomenon really took off, let's say 5 years ago.
Yeah.
Somebody had said to me that within 10 years, they expect that it'll be a bit of a ticking time bomb in people's mouths. And then all of a sudden, there'll be like this epidemic of people needing immediate assistance.
We have seen it. We've had a number of patients come here with problems. Sometimes it's a one tooth issue, and that's the best outcome probably in terms of maybe a crown's come off or they need a root canal or something like that. But there is patients we've had where the full thing needs to come out. 20 veneers, 20 crowns need to come out and start again, often with root treatments or worse, the tooth is lost. So I don't think we see a huge amount of it here. We do see a fair number, but considering the amount of people that are going, I'm not sure if they're going to their own dentist. There's certainly a lot in the media about it, but it no doubt will grow and grow and grow as time goes on. And maybe they're embarrassed to go to their own dentist, or they know the fees here are going to be expensive to pay it, so they're kind of living with the pain or living with their gums bleeding and things like that, and they just haven't actually presented to get it fixed yet. So.
There's nothing worse when you're in that type of pain. Something we kind of touched on earlier about going through the academic side of it and then the work that you have to go through. If you could go back to yourself or speak to any other like sort of aspiring dental professional, what type of advice or guidance would you give them that you wish you'd been given?
I think it's a difficult one, you know. you have to follow your passion, and usually your passion is something you're good at. So in the early days, dentistry, you kind of just need to get to grips with a bit of everything, be a generalist, see where your passion is, also see what the demand from patients is. If you're in a practice that has maybe an older demographic of patients, you're probably not going to go into composite bonding straight away. You're maybe thinking oral surgery, implants, dentures, that kind of thing. But I certainly think investing in your education is the most important thing. You can't spend enough on it. Education is expensive in dentistry. You also have to be in the field a little bit and practice to get good at it as well. So it's trying to find that balance of finding the right patients to do the treatment on, but also upskilling at the same time and investing in your education. I think something that's worked well for me is the communication side of dentistry as well. I think it's why I got into cosmetic dentistry, is because even when I was in university, I was doing little bits of it, but people were asking me before I was even qualified, can you do this for me? Can you do that for me? Just from being someone in Glasgow and you've got friends, and I used to work in a gym, and people in the gym would be asking, when can I come in to get my teeth done? So it started coming naturally to me. And then with my own patients, I wouldn't be scared to ask them, how do you feel about your teeth, and show them a vision of how it could look. And I think the communication aspect and building a personal brand and showcasing your work is massive in this day and age.
Yeah, absolutely. I completely agree. Obviously, you have to have
And just on that topic, sorry to interrupt you,
right.
we've got some dental students that will come in here and shadow and work, etc.
Yeah.
They qualified last week, so that was like their final exam. They've got their degree and whatnot. And 4 or 5 of them already had an Instagram profile, Dr. Such and Such. That just wasn't a thing back then.
Yeah.
So it's great to see that happening, but it's just a different landscape now. I think dentists who don't have a personal brand, you're just falling behind.
That's it. When I had, so the process that I went through was 12 months of having a brace, and then I was like I spent every day for a year trying to find who's doing it, and if they didn't have a lot of examples, they could have been the best. Yeah.
But never once came here, by the way, just to say it.
Too expensive for me, that's why.
You never asked.
I know, should have done. But I was like looking and because at that point it was a different time in my life, and I was like, I have to operate kind of within a budget, and I just
got a budget.
And I was like, so I'm confining myself. But anybody I looked at I thought, if you don't have examples of your work, I'm not even considering you. I don't care. Even if I was told this is the best, don't care. Yeah. Because I have to see that.
You have to. I mean, if you're going to a dentist or any kind of cosmetic procedure, you want to see what that person is able to produce. What is their skill set? I have an abundant. I could like bore people with a before and afters, and I'll usually in a consultation. Now there's AI that can give you a simulation of how it's going to look. But before and afters, trying to find something maybe similar to the case and the journey you're going to go through and show you the steps is vitally important. So, and that's a big thing in dentistry as well, is photography. Photographing your cases, documenting your cases. It becomes a bit of an obsession where, to the point you're blowing photographs up and looking at the tiny details, but it's those tiny details that matter, and it's those tiny details that make you better as a dentist as well. Probably things that you wouldn't see in your own teeth, but we kind of look at on a macro level of, has this fitted properly, is the reflection right, is the texture right, all these kind of things. So photography is a big thing as well.
It's crazy. The evolution of the business itself and the way the business is represented has been so vast. Are there any types of evolutions that you anticipate, or any changes that you think are maybe afoot?
I think AI is a big one. It's already been used to help with diagnostics and imaging. So we have an AI software on our x-rays that will click. Obviously I can diagnose the x-ray myself, I don't need it, but it gives a nice visual to the patient of, you've got a little bit of bone loss, there's decay in this tooth, etc. And also, I guess it's a safety net in case the dentist, the practitioner, has missed something. We can't rely on it fully to diagnose, but it's there as a tool and a communication tool. And AI is going to change a lot of what we do in humanity, and it's going to change dentistry massively. There's AI note-taking, for example, where you can record the examination and then the notes are already done for you.
What they are.
You might have seen the simulations that can be done where if you go for an Invisalign consultation now, you get your teeth scanned, and within 2 minutes there's a simulation of how your teeth are going to look on your smile as a video. It's obviously an algorithm, it's obviously AI, so it's not overly accurate. Sometimes it actually works against you because it doesn't look quite right, but that will be refined to the point where the AI is 100% perfect, better than any human could do. And it'll be a case of 3D printing the restorations, which can be done already as well. And things will move a lot faster for that reason.
from a commercial perspective and in terms of conversions and that type of thing, that must make it so much easier.
Yeah.
To removing a barrier and to getting to people to commit to.
I think it is. Definitely, as if you're a dentist, it's not a great communicator. Having these tools is really effective.
Yeah.
I probably use them in less than half of my consultations because people are pre-qualified. They're coming in, they've seen my work, they're coming from someone who's had the work, so you're not really needing to use the tool. But there's other patients that want to see it and want to visualize it. So it's a great tool at the consultation if you need it, but more importantly, if you were having your teeth done, it lets us be more in control and give you an aspect of control in the treatment as well.
Yeah. Obviously, our sort of focus has been sort of the meticulous nature of your work and sort of how high end and detailed you are. And, you know, people are committing time and money to essentially building a new smile.
Yeah.
A large part of that is upkeep, and a sort of Blue Peter style. Here's one I made earlier. Is the Venneir product. So just think of that for the camera. The toothpaste. So this obviously, I tell you what, instead of me explaining to an expert, why don't you explain to me what is important about the upkeep and this type of products in general?
If we discuss veneers versus composite bonding, so a lot of patients won't understand the difference between the two. A veneer typically is a ceramic or porcelain restoration, so it's made by a lab. It's impermeable, so it won't change colour over time. They hold their shine and lustre and polish really well. And then composite bonding is a resin that usually is placed directly by the dentist. Great material, versatile material, but one of its downfalls is it's a bit permeable, so it does soak up moisture and potentially staining from food over time. So anyone that's had composite bonding will know on day one they look super white. As they rehydrate and soak up moisture, they then dull down a little bit, and then over time, depending on what your diet is and your lifestyle is, they're going to change colour a little bit more. They might even pick up marginal staining, little bits of yellowish brown discoloration, etc. So that is inevitable, but how you look after them has a big part to play. So if you have a lot of acid in your diet, say you're drinking a lot of coffees, a lot of fizzy drinks, carbonated drinks, that's going to increase the likelihood. Smoking, again, is going to stain the composite a little bit more, but the products they use on them makes a big difference as well. So with toothpaste, one of the most important things is how abrasive is the toothpaste. There's various ways of measuring that. I won't go into the science of it, but abrasiveness is good to remove stains. If you use a toothpaste that's too abrasive, you score or scratch either the enamel surface, i.e. the tooth surface, or the restoration surface, like the composite. So although you've cleaned off the stains and you're like, wow, this looks great, you've left microscopic scratches that then the stains build up faster and you're chasing it and you're chasing it and you're chasing it. So it's important to have a toothpaste that's not overly abrasive. You want a little bit of abrasivity, but just a small amount so that the stains are coming off with the help of enzymes as well, sometimes in the toothpaste, but not leaving those microscopic scratches that will inevitably lead to things declining essentially over time. And I know that, for example, Venneir is low abrasivity, which is great.
I really like it, because I know what you mean as well, something like chasing that sort of whiteness and brightness. And it's one of those things that I noticed this sort of gradual decline in that brightness from that first day. I find it to be fantastic. So
there's a big debate between fluoride and non-fluoride toothpaste. Fluoride is a useful active ingredient. It doesn't need to be in every toothpaste. It really depends on the patient, but having fluoride is definitely a benefit for some things, such as protection against bacteria, dental caries, that kind of thing, gum disease. You really want to look at the active ingredients of a toothpaste. We don't want too many artificial ingredients such as SLS. So SLS is essentially a foaming agent. You would have it in shampoo, conditioner, body wash. It's actually in some toothpaste as well. It does give a nice froth when you're brushing your teeth. I don't actually like the feeling of it. But the downside to SLS, it's obviously a chemical we don't want in our body. It can also lead to like peeling of the mucosa, which is, some people might see kind of white sloths in their mouth after they brush their teeth. So ideally toothpaste should be SLS-free, and it's great that Venneir is. From a staining, I guess someone would be using a toothpaste like Venneir basically to look after restorations that have been placed, whether it's ceramic, porcelain, or composite. And there's active ingredients you want, such as enzymes that are going to help break up the stains. This has that, and it should be low on the abrasivity chart so that it's not scoring or creating microscopic scratches on the restorations. And again, this has that. So I'm looking forward to trying it, looking forward to trialing it out with my patients as well, and giving you some feedback on it.
Looking forward to that. Fantastic.
Perfect. Cheers.
What a man.